Come in.
Hello.
Hello.
I'm Morgan Asbill. I'm the PA student that's going to be helping you today.
Hello, Morgan.
Hi. Can you confirm your name and date of birth for me?
Name Leighton Swoboda. Date of birth 01/06/1999.
Okay, perfect. All right. So I'm coming to see you today because my attending let me know that you are having some problems with sore throat. It doesn't look like you have a cough, but there is a bit of a fever, and he did notice some exudate or some discharge at the back of your throat when he was examining you.
Okay.
So today what we're wanting to do is just get a culture of that that's at the back of your throat so we can test that to see what's going on. Are you familiar with like throat cultures?
No, yeah, what's a throat culture?
Okay, I can explain that to you for sure. And in doing that, if you're okay with it, we'll take a throat culture today, but I'll explain that to you first. But is it okay if we continue our visit?
Yeah, that sounds good.
Okay, perfect. So first off, the reason for doing the throat culture is to one, just make sure we're right. Pretty sure that you have strep pharyngitis, and because of the symptoms that you're having, it's most likely from bacterial source, not something viral.
Okay.
But that's good because that means it's easier for us to treat it for you.
Okay.
So what the culture is it'll be just like a few seconds of your day today. So what I'll do is I'll take a throat swab, which is like a really long Q-tip, and just stick it in the back of your throat and take a little sample. And then I'm gonna send that off to the lab here so that they can test it and see if you do have the bacterial strep.
Okay.
So I can show you all the things that we'll be using for that today because I feel like it makes it a little bit more comfortable when you know what to expect. So what we have over here is first off, just for me, gonna be wearing a mask. I know we're all used to seeing these around recently, but what that does is it helps me not get any bugs that you may have. Also I'll have gloves on so that that's keeping you safe and keeping the sanitary procedure. And then these are our throat swabs. So these are the long Q-tips. So what I'll do is just open up one of these, and then using my light source, I'll like look in the back of your throat, have you say ah, and press down with a tongue depressor so that I can get a good look at what's going on.
Mm-hmm.
And then it'll just be like a quick few seconds swipe on each side of your tonsils.
Mm-hmm.
And then I'll send that off to the lab. And the only thing that might happen is you might like gag or cough a little bit or sneeze, but that's okay. That's why we have on the mask, and I'll also have on some like goggles too, just to keep safe from any kind of germs.
That sounds good.
Do you have any questions about that?
No. I will say I do have a sensitive gag reflex, so just kind of like be careful when you do that. But
Okay.
Besides that, no, it sounds good.
Awesome. Okay. So do I have your consent to like proceed with this procedure today?
Yeah.
Okay, perfect. All right, so we'll get that done for you. All right, Mr. Swoboda, so we've got your collection done,
Right.
and gonna get that sent off to the lab for you.
Yeah, that wasn't too bad.
Good, and you did great. The gag reflex is totally normal.
Thank you. Yeah, I was surprised.
And so we should have some results for that by the end of the day today or tomorrow morning. If you don't hear from us by sometime tomorrow, give us a call. But in the meantime, since it really is looking like it's a bacterial strain, I'm gonna go ahead and give you some antibiotics.
Okay.
So with that, the one that we'll usually use is amoxicillin. Do you have any drug allergies that you know of?
No drug allergies. I had an infection on my foot like a few years ago, and we figured that all out. I'm good.
Okay, perfect. So I'm gonna give you amoxicillin. It's gonna be a pill that you just take 2 times a day for the next 10 days.
Alright.
And then I'm sure you've heard this before with your antibiotics in the past, but just make sure you finish the whole prescription. If you don't, then the bacteria can gain resistance to it, and it can just make you feel even sicker and make it harder to get rid of in the future.
Okay.
So I'll call in a prescription for you for that. And then when the test results come back, if anything needs to be adjusted based on those results, like the treatment needs to change based on the type of bacteria that it is, we can change that as well. Or if it comes back as a viral infection instead of a bacterial, we'll have you stop the antibiotics, but most likely this is gonna be what we need to continue with for treatment.
Okay.
Also with that too, make sure that you throw away your toothbrush at home after like 3 days.
Okay.
Just because the bacteria could be living on that surface as well.
Okay.
What other questions do you have for me right now?
Well, you know, I'm a working man, so when will I be able to go back to work?
Yeah, that's a great question. So take the rest of today off, and then we'll want you to not go in tomorrow either. If you have the ability to like work remotely tomorrow, you can do that, like as long as you feel fine.
Okay.
But then the next day after that, you should be able to go back into work after being on the antibiotics for 24 hours.
Okay.
And I understand like bosses and jobs and things like that can be tough, so we're happy to like write you a note.
Perfect.
So that you have an
That was gonna be my
excuse.
next question. Perfect.
Awesome.
Perfect.
What
And,
other questions?
I also like to work out.
Okay.
So I know you said, you know, it'll be a good 24 hours after I take the antibiotic to where I'll be non-contagious, but would that be okay if after the 24 hours I started to go work out?
That's a great question, and working out is great for you. We're glad you do that. Cardiovascular health and everything.
Yeah, I do a lot of like weightlifting and like power cleans, like a lot of like things that are pretty like taxing on the body, I'd say, but
Yeah,
makes me feel good.
that's great. No, that's really great. I would say a lot of it is up to you and like knowing your body. I know like it's really hard to take a day off from working out because it's enjoyable and it makes you feel better. But just listen to your body and at least wait that 24 hours. I'd say maybe for right now, try and just take it a little bit easier. Like if you could go on a walk instead or choose some lighter weights, do something a little bit easier, then you can do that. And I'd just say with that, like when you're sick in general, make sure you're really hydrating well. If you start to notice like, oh, like my mouth feels really dry, my eyes feel really dry, my like urine is dark in color, it's a sign you're not hydrating enough. So just make sure you're doing that too.
Okay. Yeah.
What other questions do you have?
No, that's it for me. You answered everything. Thank you.
Awesome. You're welcome. So there shouldn't be any real like side effects you feel from the like procedure that we did today. I know just like a little discomfort, maybe a little bit scratchiness also added on to the sore throat you already had. So just make sure like you're again drinking fluids. Cool fluids usually feel good on that. If you need to, you can get like a throat lozenge or suck on some peppermints to kind of help with moisture and stuff there as well. We'll plan to have you come back in about a week or 10 days, whenever it's easiest for you to get off of work, and just make sure everything's going good.
Okay.
But if in between now and then you start to feel a lot worse, or you're having difficulty breathing, having difficulty swallowing, or you're not able to keep down fluids or anything like that, go ahead and go to the emergency room, just so that we can start fluids or something if we need to keep you hydrated.
All right. Perfect.
All right. Thanks for coming in today. I will go get you a prescription.
You're great. Thank you.
Thanks. Bye. Disappear.
Cool.
Well done, sir.
Let's leave.
Great.